Hi, I'm Dr. Bill Berkowitz of Life Chiropractic. Welcome. Let's talk about whether or not chiropractic can help arthritis and what your doctor doesn't know. And right from the start, I don't mean to disparage doctors. They are amazing, they're committed, and they are great at what they know best. But this might be something they might not know best. When we're talking arthritis here, we're talking about degenerative joint disease or osteoarthritis, commonly referred to as wear and tear arthritis. This is the arthritis of lifestyle. This is the arthritis of putting enough miles on those tires that they eventually wear out. But do they wear out evenly or not? Now, if we look at the medical profession, the most common treatment for this is the prescription of NSAIDs, non-steroidal anti-inflammatory drugs. Recent studies have indicated that NSAIDs can actually worsen arthritis by destroying the cartilage inside the joints, and that by definition is arthritis. So the very drug that they're commonly prescribing, it doesn't matter whether it's aspirin or ibuprofen or naproxen, is actually destroying the cartilage. Not that many years ago, they had a huge recall of Vioxx, which was a miracle drug for arthritis, except that thousands of people dropped dead of heart attacks. So drugs aren't necessarily the way. Now, when we look at doctors, what don't they know? They are exceptionally trained in the diagnosis and treatment of the illness and disease. And how do they treat? They treat with a couple of real primary weapons. They use drugs, they do injections, they use radiation, and they do surgery. Beyond that, there really isn't anything that a doctor does. They can give you some advice, but the advice that they have is around illness and disease. It's not about health. When we're looking at degenerative arthritis, DJD, osteoarthritis, we are talking about a mechanical problem. It's a wear and tear of the joint due to uneven stresses to that joint over decades. That uneven stress is due to some joints not moving enough, some joints moving too much to compensate for that lack of movement. And so it's a mechanical problem. If you have a mechanical problem, it only makes sense to apply a mechanical solution to a mechanical problem. Make sense? I mean, if all you have is a hammer, everything looks like a nail. So from the medical profession, their hammer is drugs. Well, drugs don't help this form of arthritis. They can blunt the pain, but they're not going to change the arthritis. And what if we could change the arthritis so that you either needed less medication or didn't need any at all? Sound good? I think so. So it's a mechanical problem. It's a balance problem or an imbalance problem. And what does chiropractic do? Chiropractic goes in and tries to restore balance. What do I mean by that? We want your pelvis to be level. And then we restore mobility. We want your hips and your pelvis and your spine to all move. When joints move, there is less pain. When joints are not moving beyond their normal capacity, there is less pain. So if we can improve the mobility and improve the balance, we almost always reduce or eliminate the pain. If you're having any recurrent problems, even if you don't think it's arthritis, it will be at some point in time. Rather than just cover up the pain on a recurrent basis, let's get it addressed. Let's see what's going on and correct the mechanics of your spine and pelvis so that it doesn't necessarily have to devolve into arthritis. Make sure to subscribe to my social media channels and check out my website, lifewithinchiropractic.com. Thank you.